Hi there. I hope you can all hear me. A very good afternoon, or I should say morning or evening, depending on which time zone you're joining from. I hope for our international participants, the time has not been too inconvenient. No doubt in this decade, data analytics and AI is the new oil. As the coronavirus pandemic continues to cause widespread disruption, now more than ever, we see the value of data analytics and AI helping us navigate and unpack these uncertain times. We are very well versed in flattening the curve, predictive and forecasting models based on these different intervention strategies. So no doubt, in times of crisis, in data, we trust. I'm very excited and humbled to welcome our three panelists today, who are not only experts in advanced analytics, machine learning, and AI, but also some of them are working at the forefront of COVID-19 related work. Let us first meet our knowledgeable panelists. We have Dr. Sankar Khanna, Research Team Leader, Health Intelligence at CSIRO. Next, we have Mr. Steve Atropoulos. He is CTO for Telstra at Microsoft. Now, unfortunately, our next panelist is Mari Johnson, Managing Director and Chief Digital Officer, Center for Digital Business. We can't see her today due to some computer glitches. Her webcam is not working. So say hello, guys. Yeah. Would you like to introduce yourself? Maybe I'll start with Khanna. Yeah, Dr. Khanna.
Hi, I work for CSIRO, which is Australia's National Science Agency, and I lead the Health Intelligence team. So really a lot of work looking at optimizing health system performance in the eHealth research program.
Excellent. Steve?
Yes, hello, everybody. I look after our major clients, currently looking after Telstra. My role is essentially a CTO, where we look at new and emerging technologies and also emerging trends that we can apply technologies to. We've been very focused very recently on how to not only provide support to critical infrastructure like Telstra to continue to support people working from home, but also there's a lot of work that we've been doing globally on helping the overall COVID response, which we'll touch on later. So thank you for the invitation to be part of this, Lubna.
Excellent, thank you, Steve. Now, Mari Johnson with your virtual avatar.
I wish I could have an avatar there. Look, hello everyone, pleasure to be here. I'm the Managing Director for the Centre for Digital Business. I've worked in public sector and private sector for like many decades, and currently, or over the last several years, have been working in the area of artificial intelligence, digital humans as it relates to disability services and health. And so I'll just leave it there. So I'll very, very pleased that I'm able to share some of these stories with everybody today.
Thank you to the panelists, and I will also take this opportunity to thank the audience. We had lots of registrants, and I can see the numbers of attendees growing. So as you come in, welcome to the session today. So today we aim to broadly discuss multiple use cases of data analytics and AI and how they are impacting COVID-19 decision-making processes, service delivery, and health measures. We'll focus on both the current crisis scenarios and also the post-COVID digital world. So let me brief you how this rest of the session will follow. First, each panelist will present and share their experiences of advanced analytics and AI technology use cases as domain experts. Then we hope to discuss and stimulate future skills and stimulate a debate on breakthrough ideas, new service model challenges and risks, and future skills in a post-COVID world. We'll finish off with an open question and answer session. So please use the questions to ask your question. There is a questions function where you can submit your questions. Now you will have to type in your questions because the attendees don't have the mic function. And you can add your question during the presentation anytime, and we will try to get through as many of those questions towards the end of the session. I know that there are many domestic and international potential students also in the audience. We have representatives and moderators who can answer questions related to our course offerings. Feel free to ask those questions as well. So without further ado, let us commence the panel session on value of data analytics and AI in times of crisis. We will start with Dr. Khanna first. Sankalp, you are an expert in explainable AI and machine learning in health sector, right? You have been currently leading several projects at CSIRO. Could you please share with us the projects that are informing and supporting state and national level response to COVID-19 crisis, please? Thank you.
Sure, Lubna, thank you. Thanks for that introduction. So I'll give you a little idea of what my day job is like, and then talk about the kind of stuff we're doing for COVID in Australia. If I can just have my first slide, please. Thank you. So as I said, I lead the health intelligence team, which is part of the health system analytics group within, so CSIRO is Australia's national science agency. Within there, we've got an e-health research program, and I sort of lead a lot of the health system analytics work in there. For those who are not from Australia, Australia has a public health system which is similar to that of UK and Canada, and the government provides free healthcare for everybody. Now that creates a few capacity issues in a sense where there's issues like overcrowding, there's issues like system performance or wait list for surgery and things like that. And over the last decade or so, our research has been focused on helping develop AI and statistical modeling based solutions to help improve health system productivity and efficiency. On the screen, under that first tab, you can see some of the type of solutions we've developed and implemented in the Australian context, and some of these have then been implemented or adopted across the world also. We've built machine learning algorithms to predict how many patients are going to come to hospital in 4-hour slots by department, by sex. You can break that down in different ways, by specialty, for elective surgery, any of those things. We've built simulation models and to inform if I was trying to change my workflow, where would I find bottlenecks, and what would be the improvements I could potentially get, instead of having very costly exercises to implement those workflows and then find that those things don't work. We've helped with influenza outbreaks, and every year we have a bad flu season, and helping the hospital understand and prepare for dealing with that. We've done a lot of work around syndromic surveillance, which is surveillance for outbreaks such as influenza, like I said, then gastro and other things. And as you can see, some of that would be something that directly applies to COVID. We've also got systems using electronic health data in Australian hospitals to identify if a patient's at risk of cardiac attack or death, or needs ICU admission, things like that. A lot of work on hospital avoidance to identify chronic disease patients that need interventions outside the hospital system. This has been put to a national trial where it's been used across the country to recruit tens of thousands of patients for integrated care type trials. And we've done a lot of work around influencing evidence-based healthcare delivery, the policy debate, reviewing sort of implementations of technology at large government or health services, and then evaluation of care models to identify what works, what doesn't, and where the barriers are. Now, given that kind of work and the relationships we've got with state and federal health government, we sort of got drawn into helping with the COVID response as the pandemic broke. If I can have my next slide, please. As you would have heard, CSIRO is part of the multinational research collaboration that is developing or exploring the development of vaccines for COVID. So what I'm reporting here is some of the work we've been doing, or I've been leading in the analytics space per se. CSIRO is doing a lot more in other fields, and I'd be happy to connect you with people who are sort of leading that work if you like. One of the first bits one of the first exercises we did was actually help develop a dashboard to help health and government agencies track disease progression. As the disease was growing, there was a need to actually track what was happening in Australia, provide some form of comparison to what's going to happen around the world, provide some kind of forecasting mechanism. If you see in the figure on the right, that's a snapshot from CSIRO's COVID dashboard. Now, this is being used by state and federal health bodies, by places like Department of Home Affairs, the National Incident Response Room, defense organizations within Australia, to look at tracking the pandemic. And what's really interesting here is an analytics tab, which allows for some really sophisticated comparison and insight, understanding disease progression, understanding people mobility, understanding stringency, how as governments have announced shutdowns, or as they're sort of now looking at easing restrictions, what's happening and what's changing. Now, if you work for a government organization or in any organization that's sort of part of a COVID response, you can send me an email and I can organize a login for the CSIRO dashboard for you. It's not publicly available, but we're making it freely available to organizations that are directly or indirectly part of the COVID response. We've done some forecasting models. Now there's hundreds, maybe thousands of forecasting models out there using SEIR-based sort of differential equation-based models for predicting influenza, the COVID outbreak, and then some agent-based modeling, some hybrid models. We've done a few of those models for state health organizations. We've done an evaluation on some of these models and on how mobility should be captured and represented, and how the effective disease transmission is then calculated. But then we also built some novel methods that put together the current effective transmission rate and human mobility, government interventions into account and try and predict what's going to happen. The minute you have a regional outbreak, what that impact might be, where it might spread and things like that. So we're doing a lot of work like that for the second phase of the pandemic, which is really preparing for easing of restrictions and to a life back to normal. If I don't think we'll ever get to a life back to normal as we used to know it of quite some time, but helping governments plan how to open up things, provide surveillance algorithms that look at pathology data, which is testing data, hospitalization data, Twitter, Facebook data, for monitoring all of these things and having some early identification of outbreaks, or what regions might be vulnerable, what populations might be vulnerable, that kind of stuff. We are again doing a lot of statistical analysis around looking at the health system data, but also some of the economic activity data, people returning back to shopping centers and continuing to shop online, traveling around places, containment strategies as easing happens, what the related people mobility is, to do some scenario modeling and to help with some decision making. Part of that effort is also to develop a multi-criteria analysis model to support some kind of risk ranking when, as a senior government department, if you're looking at what's my risk if I do this compared to do this, to provide some kind of data-driven method and an analytics-driven risk scoring for having that. And we're sort of building that for a couple of state departments. On the genomics front, we've got a very big transformational bioinformatics team that is working in Australia and overseas, and they've helped to identify the right viral strain for preclinical models. They're also testing all of the different viral strains that are being reported around the world to then understand how these outbreaks are traveling. By looking at a certain viral strain, you can identify that, look, this strain originated in China or in Germany or in Italy, and then where that movement has happened. Some of these dashboards from CSIRO and other organizations are now freely available to look at. But really the aim here is also to probably develop an early warning system where if you see one strain become more virulent, you can sort of try and then have an early warning indication of how that might impact certain regions. So that's the golden aim in that space, really. So that's just a quick snapshot of the kind of analytics, AI, statistical modeling research we're doing, which is really applied and everything's being developed with the view of implementing it to inform the planning and sort of decision making for the current pandemic in a way that it will also apply to the future. But yeah, happy to take questions on some of that. Thanks, Lubna. It's back to you.
Thank you, Sankal. I think you have given us some great insights into how analytics is helping us to make decisions, and I think the multiple examples that you've used, starting from infection spreading to mobility to productivity, bottlenecks and easing of restrictions. So we can see how fundamentally these skills are very important in times of crisis. Next, I want to invite Steve. Steve is also part of our advisory board, who helps us. The advisory board is there to help us to look at industry, the curriculum that we are teaching and what we should be teaching in future as well. So Steve is part of Microsoft, and I'm sure Microsoft is doing some exciting and interesting work during this COVID crisis. Could you please share with us some of those exciting projects? Thank you.
Yeah, thank you, Lubna, and also very interested to hear what the CSRO is doing. I probably will set the perspective that Microsoft's value proposition is effectively a platform provider and a provider of tool sets and capabilities for others to do some fantastic work, perhaps like the CSRO is doing. And I wanted to speak a little bit about what we have been doing, what we've been seeing in the application of our tool sets to create decision-making capability, both for the public and for the private sector. And then I'll touch on some of the kind of overall trends that we're seeing and something that we should be considering perhaps going forward, and maybe that would simulate some of the Q&A. So what I've presented here is just a couple of local examples, ranging, starting from the left, I should say, with our own very own Bing search engine, which we've updated with the coronavirus data sets that have been publicly available through the WHO and the CDC and various other sources that we effectively amalgamate and bring together into dashboards that anybody can see. Some of you may have noticed that if you go to Windows 10 and you click on the start, it actually presents a link to the coronavirus data sets. You can just go to bing.com and type in coronavirus data or something like that. You'll eventually end up at this site, and it effectively allows you to just click through and see what's going on in your region, down to the state, and do comparisons between different parts of the world. So that's really us doing a sort of first-party service to help people, as wide and broad as possible. But I think a lot of the exciting stuff's actually happening when our partners and our customers actually take advantage of the tool sets and create capability to serve their unique response. One of the ones that I like to talk about is the Victoria Department of Health, how they are using the Power BI platform. It's just basically a data analytics platform, and are providing a self-service portal. Again, there's a link to that, so perhaps we can post that in the follow-up notes there, Lubna, to all of these services, so people can zoom right down to their suburbs in Melbourne and the city that we live in, that I live in anyway, and you can see how people, how different areas, suburbs, are being affected by cases. So this is what we're finding is that a local, having the data and having local decision-making capability through the data, but presented in a way that can be easily consumed, but also being presented on mobile devices is absolutely critical. But certainly behind the scenes is the AI and the machine learning that goes on to actually look at that data and try to make some sense, and even predict and classify some of the scenarios that are being presented through the data. And this is effectively where the next, effectively the next wave of usage of tools is happening right now that we're seeing. Another interesting class of services that we're starting to see our customers look at is the way people work from home, and the impact it's having in their workflow, in their mental states, in their ability to connect with the networks that they have traditionally formed when they were coming to the office, and looking at how productive people are getting, and even maybe where they are improving in their productivity, and where is productivity perhaps flagging. And so there's a set of technologies, and it's not just for Microsoft, but there's a set of technologies. Our version of that technology is called Workplace Analytics. The more you use the cloud, the more we bring that technology forward into a telemetry that can be grouped together and presented to decision makers, workspace decision makers. And here I'm presenting just a snapshot of the business continuity report that we provide for people to look at if they are onboarded into the Microsoft cloud. They use email, they use Teams, or they use all sorts of tools to collaborate. That information is being aggregated and presented in ways, of course, anonymized and privacy is protected. This is not stuff that we see, but it's stuff that is available to the enterprise to be able to make decisions on that. And then we're seeing another class of capabilities that are being put into the market, and that is more for self-service and help. People can not just look at the data, but also interact with the data, and maybe the AI from the data is surfacing up into things that could help people. Now, in today's wave of capability, they're in the form of bots, or in the form of interactive websites. The CDC, for example, in the US, is using Microsoft technology with quite a lot of AI behind it to allow for self-diagnosis. Also, we've been working with Austin Health, again here in Melbourne, in the labs to be able to look at not only a self-assessment platform, but also looking at very similar problem spaces that that the CSIRO are looking at, and looking at patterns of the data, and looking at some of the forecasting, but also to feed that back to the bot. So as people enter more information about their situation, that actually informs the data sets, and the categorization and classification becomes more effective. If I could have the next slide, please, Lubna. Thank you. However, the other thing to be very mindful of is that data is being aggregated and collected, and it is being more willingly provided by people that in the past would have been more defensive about sharing information with institutions and government. And so preserving the privacy while addressing the challenges of COVID-19 has been one of the areas that we've been focusing on as a platform. Again, as we provide tools and capabilities to governments around the world, and the ability to, obviously, people wanting to be protected, and many of the governments want to do the right thing, being able to have a principled way of using the data so that trust continues and doesn't create enduring challenges with people's privacy and people's sense of democracy and so on, is not to be sort of degraded over time. So we've this is a blog, and I think it's worth a read of some of the areas, and I think that there are important areas that could be that are challenging and maybe provocative into thinking about how we use this data. Of course, the key thing here is making sure that collecting meaningful data, but being very transparent about the data, making sure that we're looking at data that is very relevant and defensible, that it is about health, and of course the minimal amount of data. So we're seeing, for example, platforms like iOS and Android, both Google and Apple collaborating on Bluetooth key sharing, and then surfacing those patterns up to application providers. There's a lot of thought put behind that around, we're not really interested in capturing all your health data, but more around what is relevant to solving this particular problem. But in the end, what it really boils down to is individuals having the ability to look at, where appropriate, look at that data that is being collected about them, and being able to have choice whether that data will actually surface up to institutions and government. And of course, logical things like providing the safeguards to secure the data is absolutely critical. But then, as we look at more of the ongoing capture of that information, being able to assure people that data is deleted, and is not necessarily needed for anything else beyond the COVID response, and sharing that data to where it should be shared is absolutely critical in engaging the public and engaging trust. So these are the principles I think we should continue to maintain for not just the COVID period, but for all types of data gathering. I guess it brings it more into focus. I think the next slide, please, Lubna, just to be mindful of time. I just wanted to cover off some of the things that we're seeing as emerging trends, and again, maybe we could cover some of these in the Q&A. Obviously, working from home will become a lot more normal, or working from anywhere. We call it hybrid work today. Of course, when people, we touched on that a little bit before, but how do we know people are engaged and healthy when they do that? But also importantly, we're seeing cybersecurity playing a much bigger role in the work styles. Traditionally, a lot of organizations with assuming people will go in behind a firewall and go and work from home, or work from the office, I should say, but when they come to home, they would use a VPN to come back into work virtually. But the reality is that doesn't scale. And so going to the cloud directly to service people's work styles and using new tools like the one we're using now requires a different way of cybersecurity. And data and analytics is playing a huge role in that, in looking at the patterns of attacks and the patterns of interactions people are having with the cloud to provide AI-driven ways of protecting people and threat protection being detected and acted on. Of course, resilience is important. Like where are the weak links forming? Is there a high dependency on suppliers? Is there a high dependency on a particular geo? Is there, how do we deal with redundancy and resilience over time? And again, that's going to be a very key area that data can inform decision makers on. And when we look at new business models emerging, not only are we sharing data with mobile devices, with health institutions, but also people getting more and more online in the way they get products and services. Food distribution, for example, is becoming very much a norm in many parts of the world. Which traditionally would have been seen as an emerging capability, but now it's been seen as almost a normal way of acquiring food and products, everyday products. So that will continue, and we feel that a lot of companies that we're certainly seeing with our customers are accelerating the digitization plans to capture these new business models. So again, something we can chat in the Q&A. Thank you, Lubna. That's what I'll share for now.
Thank you, Steve. I think we got an interesting, platform perspective from you and what tech giants like, Microsoft is doing. Also, I would thank you for raising, some of the discussions I want to unpack a little bit further, later on about these breakthrough ideas, the new, COVID world, post-COVID world, I should say, what would be the new normal, and if we could speculate a little bit on that. Next, I want to move to Murray Johnson. Now, Murray is the creator of Nadia, which is the first AI digital human for government service delivery in Australia. And I heard her in a keynote at a conference, and since then I've been a fan of her. So she is a humanitarian entrepreneur, and she's also now building the digital human cardiac coach. Now, Murray, you have been a pioneer, in digital humans. So what role do you think digital humans and more broadly AI robotic applications can play during pandemic crisis? Now, unfortunately, we can't see Murray, but we will obviously be able to hear you.
Thanks very much, Lubna, and phenomenal to hear that colleagues speak about many things here. I might just go on to the second slide. What I will position my few words about is extreme human conditions and complex systems, and the the impact of these on servicing models. What we see here is a brilliant photograph of the Space Shuttle Challenger exploding. But several decades before, there were decisions made that led to this. And one of those decisions was the way in which components of the Space Shuttle assembly, so the booster rockets, were to be designed and delivered in different states in the United States, which required the components of the boosters to be assembled. And that assembly required O-rings, so components joining the assembly. And the night before the launch of Challenger, engineers were meeting, and the predicted temperature was freezing. And the engineers provided advice to NASA management that this low temperature would lead to the freezing of the O-rings and almost certainly would lead to the failure of the space shuttle should it launch. So two things happened. The architecture was influenced by political decisions decades earlier, and on the night of the launch, the advice of experts was overturned for political reasons, and this is what happened. So I want to sort of continue this theme of complex systems and crisis events. And if we could go to the next slide, please. And so what can these extreme conditions teach us? So this is the International Space Station, and there's phenomenal stories about how health services are delivered to astronauts on the space station. Many people up there for 6 and 12 months. And telehealth actually occurs to the space station. They are equipped on the space station to undertake certain procedures, and they have definitely a lot of equipment and AI on the International Space Station. But there are phenomenal case studies of doctors on Earth doing telehealth calls to the astronauts on the space station. So extreme conditions, such as the space station in space, informs many things on Earth. And I want to continue this theme, so we need to look outside the norm in order to think about what's in front of us. To the next slide, please. So again, what can extreme conditions teach us? Here we see a young woman completing the London Marathon in an exoskeleton. I actually completed the London Marathon this same year. I ran, but it took me a lot of effort to do it. This young woman, it took her weeks to complete it with her exoskeleton. And then if we look at the astronaut doing a spacewalk, untethered spacewalk, we see in both of these concepts fragile humans in extreme conditions, and the innovations that enable the astronaut to undertake this spacewalk are very similar, in fact sometimes the same, to enable people who have other disabilities, if you like, to be able to function on Earth. Now I'm going to come back to this in a number of slides. So if we think about this young woman doing this marathon with an exoskeleton, that exoskeleton is in fact an expression of service delivery. Think about if that could be a funded support, a funded service through which that person could undertake her daily activities. And when we think about the astronaut, think about how immobilized their hands are in their very complex spacesuit. And I'll come back to that again. And this will all come together in a very interesting way. So the next slide, please. So I want to spend just a few words on Nadia. And this is obviously an image here of Nadia with one of our phenomenal people interacting with her. And I'll just go to the next slide. So Nadia was, and at the start of this work, this is before the technology was brought together, I met with Sir Tim Berners-Lee to understand his work on the human accessible web, and to also share with him the concept of Nadia. And the challenge that was presented was based in human rights and how people with disability of all conditions, physical disability, cognitive disability, intellectual disability, can be fulfilled in their human rights in accessing information and services in their own context. And many government services and healthcare is very, very complex. There's complex concepts, there's very convoluted websites and very convoluted forms. And when we brought people with disability together, what they said was, what we want is just a face and to have a conversation. And all the rest can just, if you like, go into the background. And so that was our starting point. So there was no, 300-400 pages of documents to describing the business requirements. What you see there, that coloured crayon drawing, was the expression of what people wanted. A simple conversation. And about 12 months later, there we have the human realistic avatar co-designed with people with disability. We gathered content to drive that, developed dialogue models. So this was not just a question and an answer model, because many of the concepts that government and healthcare have are very difficult for people to understand. And so we had to develop a narrative model, a dialogue model, through which people could interact and glean that meaning. And we had university psychology faculty working with us in support of people with intellectual disability. And it was their determination when they said, yes, this dialogue model is appropriate for people with intellectual disability, that we then said that was right. And so this is what we did. The idea of Nadia was omni-channel. So here we see a face, but we had in plans to do other channels. So not only social media channels, but to put it into virtual worlds and Second Life, where people with disability ordinarily go. So this was the first human realistic AI-based digital human for service delivery worldwide. And it was creation of people with disability. So again, just keep thinking about what these extreme conditions can bring to the surface. Quite phenomenal innovation. And if we go to the next slide, please. And so here we see this thinking applied to cardiac health. Now this gentleman is my husband. He has 8 cardiac bypass grafts and 4 stents. He is an industrial aeronautical engineer, so with a research background also in expert systems. But what we've learned over the last 14 or 15 years is the impact of health illiteracy on service delivery, service design, and we've also moved through and written about the impact of health illiteracy on machine learning. Now, health illiteracy means that most forms and government communication, health communication, is written at about the grade 10 level, and yet most people have literacy levels at the grade 5 and below. Now, that means that people cannot understand information. They cannot even navigate their way around websites. And this is actually structural discrimination, very similar to what people with disability face. So here what we have is a situation where services that are being delivered, the communication actually affects health outcomes. And research in the United States has shown that health illiteracy is a significant impact on cardiac vascular disease outcomes. It's one of the big drivers of early death, but also significant costs within the health system because people simply don't understand. So what we've seen during COVID is that around the world, cardiac rehab services have been closed down. We've been on webinars with cardiac rehab associations around the world, and this is something that everybody's dealing with. So COVID is a pandemic, a contagious pandemic. Cardiac vascular disease has been a lifestyle pandemic for 2 or 3 decades now, and it kills about 18 million people a year. So what we see here is services to support cardiac vascular disease and cardiac rehab being closed down, while the health system, which is quite fragile, is diverted to the treatment of the contagious COVID pandemic. So I've been working with a hospital in the United States, the New Hanover Regional Medical Center, on a digital human cardiac coach that can provide people in a very conversational way with information about cardiac vascular disease and cardiac rehabilitation at any time, not just in the hospital, not just on discharge, but our objective is to have this throughout life. Our work on the impact of health literacy on machine learning was released on GitHub a couple of weeks ago. And the issue here is that crowdsourcing from experts or from people who are health illiterate, and in the Australian population, 60% of the population does not have adequate health literacy. So that means the usual approach of building a corpus from experts is flawed, because the experts do not express themselves in the way that people who are health illiterate would, and even the concepts are quite foreign. Equally, crowdsourcing a corpus from general population who is health illiterate does also not work, because not only does it lead to gaps, but it also leads to significant errors. And in the health setting, that is quite an issue to deal with. So what I'm putting up here is a new model of service delivery built on co-design with a new dialogue model, co-designed with people, with health practitioners, bringing together the patient perspective over their life journey, and also the perspective of the health practitioners. So if I can just go to the next slide, please. I'm conscious of time. So I mentioned that we had plans to have Nadia with a presence in Second Life. And here we have again this crayon drawing that we did, where Nadia was to be one of the avatars in Second Life, and people with disability could also choose to have their own avatar in Second Life in a NDIS, National Disability Insurance Scheme, Second Life type of environment, where people could interact with one another as mentors and connectors. And we know that people with disability are avid users of Second Life and virtual worlds, and they say they can be whoever they want to be. So when extreme conditions leads us to fundamentally rethink servicing models. So if we go to the next slide, please, and we can see where this is being applied and has been applied clinically in a number of areas, increasing number of areas around the world in the United States. Now here we see 2 phenomenal examples, one being SimCoach, which is a virtual human. This is done by VA in the US, and there's a number of different personas. Here we see a male persona, but there are female personas as well, interacting with return service personnel and veterans to monitor for signs of PTSD. And this has been clinically evaluated by DARPA. When we were doing Nadia, we looked and studied at this in quite significant detail. The other example here is the Virtual Health Adventures, again, a VA, US VA initiative. We're using avatars and Second Life to provide people with rehabilitation following amputation. So people getting used to moving around in their environment, people getting used to understanding life as an amputee. Now, what both of these phenomenal examples have shown is different servicing models and how virtual humans or digital humans, immersive environments actually lead to behaviour modification and information transference. Just go to the next slide, please. And so what we really see here, if we're thinking about where we are in the COVID environment and the very fragile servicing models that we have, where cardiac rehab, which is so essential, gets shut down, so the health servicing models can be rediverted to meet the current challenge. Now, this clearly is not sustainable. And so what we're seeing here is, in a time of crisis, this Copernican moment, where we move from the, everything revolves around the Earth to, the planets revolving around the sun. So where we had healthcare being, if you like, sick care centred and hospital centred, to being really person centred. So here we see exoskeleton, and I've seen this in action. The National Disability Insurance Scheme in some areas funds exoskeletons because of the broader through life benefit it brings. But having IoT connected exoskeletons, which is happening, and in this case means that a physiotherapist can actually have a remote consultation with a person while they're wearing an exoskeleton. We see a patient wearing a VR headset as part of their mental health regime, their treatment regime, and there's clinical evidence to show that this is very effective. It needs to accompany other treatments. Down under that image, we see a surgeon, a good friend, Dr. Shafi Ahmed, who is one of the first surgeons to use VR during surgery. Then we see this image of Deepak Chopra, who has created a digital human clone of himself. So we think about Nadia, that was something that was created. Here we've got somebody that has created their own digital human likeness, and the corpus is all Deepak Chopra's life experiences and all the many things that he has worked on as part of his service delivery. And then we have the Apple Watch, and I can't tell you, for my family personally, this has been a lifesaver, literally a lifesaver. And so this has been approved by the FDA in the United States, but in Australia it has not yet been approved for use. And so what we see here is this Copernican moment, where servicing models not only will have to change, but they are already changing to a more patient, person, whole of life centric approach. So this is where I see this Copernican moment being something quite different. We could just go to the final slide, please. And so there's a whole body of work to be done around ethics, and ethics provides guidance through crisis moments, but also through transformation. So through this, movement from the Copernican moment, if you like. And when you think about digital human remains, so that's not just about the concept of Nadia or the concept of the digital human cardiac coach, but this is where our digital, not only footprint, but everything about us, what happens when we die, our digital human remains remain, and they remain on some very powerful platforms. But so there's a whole body of work to be done around the ethics of that, but also the ethics of opportunity. And that is what really I'm focused on, to say it's not good enough for the system to close down and for millions of people not to be supported just because the system is, the current model of system is fragile. So I might just pause there.
Excellent commentary, extreme situations, and how that helps us to think about the extreme situation. We will move on to the discussion, and I think this is a very excellent presentation for a good segue to what I wanted to discuss next. Turn on your microphone and videos. Excellent. So you're obviously welcome to join whenever you want to have something to say. So interestingly, I think what already we have learned from the panel presentations is that COVID-19 is working as a catalyst for us to think about, the post-COVID new world. And I think Steve has given some ideas of how the new world might look. And I think Marie has actually shared with us how it might shape, if you like, and these extreme situations, just generally about, how extreme situations can help us to think about how it might shape the future. So my first question to the panel is that, what do you believe, these extreme situations that we are, observing right now through this crisis, how will it shape AI, data, and analytics in future? So concentrating on, these technologies as, that's the focus of the discussion today. But how do you think it will shape the future? I mean, what would it look like in future?
Look, I might start with, it just seems to be a topic, quite a big topic of discussion at Microsoft, which is that as more and more data is being collected about individuals, about systems, we see a new tsunami of, if you like, data capability being generated by devices. So the 5G rollouts and IoT and so on will actually generate even more data. Just like Marie was referring to the Apple Watch, which is a type of IoT scenario, right? And they will either manifest themselves as virtual agents and virtual capabilities over time as well. For the data will represent the world in a virtual way. As more and more of this data is being collected, probably the biggest thing to think about is how that data is biased. Is it being biased in a way that creates transparency and fairness and can be applied correctly? And we're starting, like the riots we're seeing in the US and the challenges we're seeing there. Is the technology being applied correctly, and is it being applied in a fair way? Is a big topic of discussion, I guess. Everything from policy to the practitioners on the ground and to the technology. So one of the things perhaps our Microsoft research teams are looking at is how could you even use AI to de-bias data? In other words, you take humans who could be generally biased out of the equation and try to build systems that actually de-bias the data in ways that perhaps we would never think about it. So that in itself sounds a bit circular because how do you unbias the AI that's doing the de-biasing? So there's a lot of research going on right now just on that, on that topic. So yeah, that's one thing I want to put out there is the ability to trust the data, de-bias the data, and make sure that we can trust the models that are implemented around our world.
Look, I might add something there. So there's a popular catchphrase going around don't waste a good pandemic. And I think the data analytics AI community has managed to achieve quite a lot in the past few months, things that they've been trying to achieve for years. And there have been a lot of exemplar demonstrations of effective partnerships, of data and information sharing, of data-driven decision-making, and of technology-enabled lifestyles. I think Steve touched on that a little bit. And I don't think there's going to be a going back to business as usual or lifestyle as usual. And I think in your post-COVID world, technology-empowered disruption is going to go well beyond the Ubers and the Amazons, right? From a health system perspective, which is my sort of expertise, I think there's going to be a strong focus on system preparedness, crisis preparedness, on data-driven surveillance, on technology and data-driven decision-making, and in technology-supported healthcare delivery. And telehealth's a very good example of that. I mean, there's been efforts to get that going for years and years, and it's suddenly the government putting money behind it, and people who've been, trying to get that going for years will testify to how the leaps and bounds that have been made in the past few months. So I don't think there's a going back to lifestyle as usual. I think that technology-aided lifestyle, we accept disruption in the taxis and the online orderings. I think we're going to accept it a lot more in our lifestyles and in the health system now.
Yeah. If I could make some comments, thank you very much. And the comments on bias, I think, is really, really important. So from my perspective, and the lessons from Nadia and the lessons that we've done in the Digital Human Cardiac Coach, is that you know, the diversity of human experience presents, if you like, a way to redefine some of these models. And we talk about bias. I can't tell you how much bias there was when we're doing the Nadia project, right? From many levels. And so we had phenomenal people, you know, a gentleman who was doing a PhD in haptic communication, a deaf, blind gentleman, you know, people who have intellectual disability. And the system would say, well, you know, how can those people ever contribute to a design? And we need to move from this patriarchal sort of, you know, do things for people rather than allow people to be, you know, fully involved in leading the design itself. So there is a real mindset change to be done here, and you know, a number of these systems which you know, obviously based on big data sets, absolutely discriminate against people who cannot move, you know, who move all the time, you know, who cannot see and so forth, or who might just look different. And might look different, that might be due to, obviously, you know, just, you know, what culture you are, or it could be that, you know, due to disability. And so I think this issue of bias needs to be really looked at, because I think, and it's not just about human rights. If you look at it differently, it actually unlocks a lot of innovation. And so I'm quite interested in following that.
Excellent. Research that a lot of these technologies are the technology and I think from what you found for design, taking the user partner is the most important way forward. Now, obviously, the disruption is some kind of steroids, right? Analytics and AI as much as possible. So can you hear me?
We're having problems hearing you, Lubna. I think I'm not sure if it's my end or yours.
I'm having difficulty.
No, I'm having significant difficulty also. I can't hear you, Lubna.
Perhaps you can type the question in the chat.
And your video's cutting out too. So.
Or perhaps no. Perhaps you can try typing the question in the chat, and we can take it from there.
Yeah. So basically, my question is about challenges and risks.
Can't hear you, Lubna.
So while Lubna's trying to fix her session, we've got a couple of questions from the audience. So I might just go to those while she's trying to fix her audio. And we've got a question here for you, Dr. Khanna. Are you using AI to analyze the impact influence of health-related communication on individuals' behaviours / choice?
So can you just repeat that question?
Absolutely. So are you using AI to analyze the impact or the influence of health-related communications on individuals' behaviours or choice modelling?
In some limited form with what data is available. So we are in the process of collecting a lot of data on, and I'm guessing this question is in relation to the current COVID crisis, and not broadly. So broadly speaking, yes. In specific relation to the COVID crisis, there's an effort in Queensland called the Health Barometer, which actually works on a Microsoft platform there, Steve. But the effort is to collect data on a lot of different things, including some economic data reflecting some of individual behavior, and to collect some of the mobility data, to collect some other sources of data, including shopping trends and things like that. And then to look at some of the government decisions, some of the health-related communication with the COVID crisis, some of the policies and the interventions that were announced, and as they were sort of eased, some of other events that happened, such as some of these rallies and things like that, and how that has affected some of these different data points that we've collected. Now, some of those data points we already have, such as the economic activity data across the state of Queensland. Some of the other data points we're in the process of collecting. So yes, we are looking at that with a view of possibly also trying to understand what worked and what didn't to inform future pandemics.
Thank you very much. So I'm just going to keep going because I can see Lubna's not back with us yet. I've got a question here that I'll open up to all of the panel on what is the difference that AI is making in COVID responses compared to, it says compared to pre-AI. So I'm guessing maybe it's referring to the shift in AI that you're seeing in the response post-COVID.
So did you, yeah, okay. Go on, Marie.
Yeah, if I may just say a few words there, and also picking up the previous question, the impact on the way in which government and health communication is structured has been well documented, and there's a lot of peer-reviewed research about this. In fact, the way in which health communication affects people's decisions is one of the biggest drivers of medical malpractice litigation in the United States. So, we know that the way in which communication is delivered is not being understood by people. People aren't able to understand it and adjust and modify their behaviours, and as a result of that, they either have other health events or worse, and as a result, there's litigation and a lot of costs. So there's a lot of information on that. The question about how AI will change this is absolutely critical, and the way in which we build out our corpus from at least for cardiac, but this is the same case for COVID. So there's a number of COVID apps and chatbots and whatever that are out there. They still all suffer from the same problem, and that problem is they do not address health illiteracy. They're basically taking expert information that's written at a very high level for mostly medical and professional consumers, and then blurting it out in a chatbot that people who are health illiterate mostly are meant to understood. So AI is going to be even incredibly more important to come up with dialogue models that maintain the integrity of the intent of the information, but yet the dialogue is able to deliver that in a way that people who are health illiterate can understand. So that I think is something that, and I've put all that stuff that we've done on GitHub. So it's quite a big area, and that question is excellent.
I want to just add just one thing, that the way we see AI is that it is increasingly pervasive in everything that drives the technologies, products, services that we're using. So it's being implemented in different ways, and we have a long way to go to make sure that it's implemented fairly and transparently, and a lot of education in the practitioners as well. But I just want to highlight the fact that it's already there, and it is participating in the form of, as we see it, analytics, in the form of predicting, in the form of forecasting. But I guess one could argue, well, we had predictive algorithms, we had analytics, 10 years ago as well. So what's different? I think the difference here is the fact that a lot of the data that is being reasoned over is coming in so many different formats and so many different streams at such velocity now, that being able to capture that and manage that at scale is probably the real big difference here. And this is where the clouds are playing a role, whether it's Amazon, Azure, you know, our offering, or Google. So that large scale data and processing of the data, but then of course that brings a whole bunch of the other things that we talked about before as challenges. What we will see, I believe, in the very near future is where we're closing the loop on control. So it's one thing to look at the data and categorize and say, hey, you know, there's a face, or there's a number plate, or there's somebody with maybe a high temperature, which, you know, is being built into video streams now, to actually closing to action. And whilst that, you know, has its own challenges, that's where a lot of the productivity in both healthcare, all the way out to, you know, mining and so on, will be influenced by the way AI, you know, acts on the physical world. So this is an area that is going to start developing very, very quickly as we lower the latency between detecting an event. Perhaps it's a video stream that is detecting someone maybe with a high temperature, and the lock mechanism on the door that individual is trying to get through. Again, probably a scary scenario, but the ability to close the loop between detection and action is going to be effectively the pattern of the future, right? And hence, that's where we need disciplines of fairness and trust on the data and debiasing the data, because it will impact lives if it's not implemented correctly.
And look, I think both of you pointed to some of the risks and some of the challenges that are out there. And we've sort of touched on the trust bit a little bit. I think we need to be a little careful in understanding some of the challenges this current pace is creating also, because we've seen a few retractions, we've seen a few pieces of publications in very, very high impact journals being retracted because they probably didn't go through the same level of rigorous review as they would have expected from that journal before. We've seen a lot of research that's not been peer reviewed put out there. And I think in terms of looking at some of the content that is informing decision making, one of the things we have to understand is the strengths and weaknesses of the data that's coming together at this rapid pace and is being used to inform the modeling, the decision making, the analytics side of things, and how we filter through all of that noise. Right? There's data that's being drawn out of China that's being used to do models for the US that have then realized that, okay, our presentation rate to hospital is very different, and all of those models have been adjusted. The Australian context is actually even more different. Our hospitalization rate is a lot lower. Death rate's a very different thing. And understanding all of these things and understanding the caveats of some of these models, sometimes it gets taken out of context, right? And I think that is probably one of the dangers of the fast pace at which some of this stuff is coming out.
Mm.
Okay, so we'll just keep going while Lubna continues to work on her sound. Lubna, can we hear you any better now? No, unfortunately we can't at the moment. But that's okay. So we've got a lot more questions. One is for you, Marie. We've got a question about whether there's been any case studies into how Nadia is integrated in a service delivery with increasing demands for home-based aging and aged care. This would be a promising solution.
That's a great question. And in fact, some of the work that I've been doing in the US with the hospital in the US, one of the things that we've been looking at is in-home, the in-home use cases, and where a digital human, for example, could interface with home sensing. And this is where I think we need to, really move our focus from, age aging and aged care in a big facility to supported supported and safe aging with obviously this technology as in home for as long as possible. And the particular example, and look, there's a lot of these technologies that this particular example I use. It's called HomeSense out of the University of Florida, who have these sensors in mostly home units, etc., in different locations where people might be elderly or living at home. But the sensors, and this has been going on for many, many years, assist the person to live independently and assist their family as well. And so the sensors are, in the bathroom, literally in the toilet lid, in the bed, in the kitchen, a kettle, the fridge, etc. And these sensors build up over time for individuals what they call the song of the home. And it's this pattern. And so if a person, gets up 4 times during the night to go to the bathroom, that might be a pre-indicator of, a urinary tract infection, for example, or some other condition that, rather than waiting for an event to occur, can actually be a pre-indicator. So some of the thinking that we were doing has been having like a digital human concierge within a person's home, where some of these sensors can trigger a conversation. So, you got up 4 times to go to the bathroom last night, Mrs. Brown, perhaps we need to have a conversation, you're feeling okay, etc. So, so this is where this thinking actually is going. And of course, not always for, English speaking, and also for people, so we wanted to be able to have localization for different cultures and different languages, and different localization means understanding, what people would eat, for example, as well. So, so when I say case studies, this is sort of a current, current work that's underway. And the webinar I did a couple of weeks ago, the video's up. Dr. Chris Hillier has spoken about some of these things that we're actually planning on. I would hope that this would come back to Australia.
Thank you, that's great. So I'm just going to go to Steve now. I've got a question on, are you aware of examples of AI platforms that are accessible to small businesses to operate in the post-COVID or the new normal?
Yeah, look, and it's an area, and I'm sure Google, Amazon will say similar things, that we're, as a platform, the whole idea about AI is to democratize access to it as much as possible. It's not about elite, scientists or people with knowledge that they will access these tools. As perhaps maybe that's a characterization of our generation today, is that these tools are very available through the cloud, and that's probably been one of the advances. Now that comes with knowledge that one needs to acquire. There's different layers of knowledge. If one needs to start with a workbench to consume data, put it into a studio, and take off-the-shelf classifiers and inference engines potentially to come with an analysis of data set, you could do that within minutes. If I can only speak on our platform, but you can just look at Azure machine learning and off you go. I'm sure similar things with other platforms happen as well. And literally it's a next, finish, put your credit card and off you go. The level above that though is probably where it gets more interesting, where there's a movement of what we call low code and citizen code platforms that are opening up. Microsoft's version of that is called the Power Platform. Power Platform enables people to basically build applications that are on the web and on mobile devices, but consume AI-driven APIs. So this is a very interesting kind of development over the last 5 years, where a lot of the vision, natural language processing, a lot of the cognitive analytics that might go behind analyzing a dialogue are being surfaced up as APIs that you can basically consume within your application and just pay by the the invocation of the API. So, it's there's a free tier, and then there's, tiers above that you pay for. Those APIs are being integrated into those self-service applications. So if you build something in Power Apps, in our case, Telstra, for example, has built an application that the technicians will go out in the field and they will point the phone to a tower, and it will use the classifier that they have trained with images. They've just uploaded those images of different radio towers, and it can determine what type of radio tower it is. And literally all you do is you point your phone. It uses the standard camera on your phone. It uses the API that is available in the cloud. All they did essentially is upload the images. So that was a training that took place. There was a couple of students who built that, the classification of the data based on images uploaded, and was available in that Power App. So that I would classify as a tier of capability available to small businesses and anybody who want to build that type of capability into their applications for new problems to solve. And then the layer above that is where you're seeing overall software as a service systems, like anything from accounting systems all the way to health and safety systems, are all effectively taking on an AI capability inside them. You may never see that, but it is what the developers that we speak to are very excited to utilize those same APIs or that workbench I referred to earlier, but empower their applications to make them smarter and more responsive and more clever with the information that is put in them. So AI itself is not something you just go and get. It's something that is a capability that is surfaced up as workbenches, as APIs, and empowering applications through a software as a service. One very quick example, by the way, of that is that if you use this morning, actually, I was just I get a regular email from an internal AI that roams over the data on our Office 365 environments, and it looks at my emails and looks at everywhere I promised something to be done at a certain date, and it actually creates a report for me and said, you said this yesterday to this person, you've committed something, do you want me to create a task out of that? So I just click on add task, and then it adds it to my task list. That is available to everybody. Anybody can use that service if they're subscribed to Office 365, and that's a good example of how AI is surfacing up to be available through these software as a service applications.
Thanks, Steve. So,
Okay,
look,
thank
I'm not
you.
sure if we can hear you, but this question's really for you. We're getting quite a lot of questions around developing skills into becoming business analysts, career switching, and in between data analysts, but also how students can prepare, or not even students, but people in the workforce can now prepare themselves for AI. So I might just share the courses that we have available, but if you could speak a little bit to how you think people could develop their skills in those areas and the most sought after skills from industry.
Can you hear me now?
Yes.
Yes. So just turn the video, so it's better. So off here, see something going on.
Unfortunately,
hear
we
you.
seem to have lost you, Labna.
Oh, you can't hear me at all?
It's seeming a little bit better. Maybe if you turn your webcam off, if we could just try doing it through voice, it might help your audio stream. Yes.
So thank you for asking that question. Basically, Deakin Business School has been a pioneer, in business analytics. We were the first university that offered a master's in business analytics. Now in 2020, due to demand, we are also offering an undergraduate course in Bachelor of Business Analytics from 2020. Also keeping up with the skill set, we know that AI is more than, important more than ever. So we also have, during the pandemic, we are offering for domestic students only a graduate certificate in information systems and a graduate certificate in AI in business as well. So fundamentally, I think from today's discussion, we have seen that it's not just during crisis, analytics skills, AI skills are here to stay in future as well. So these offerings are very important, for students, for jobs for future. I would actually like to now ask the panel though, what do you believe are the set of skills, from industry students need to upskill themselves and to get a job in a post-COVID digital world, and what we should be teaching at the university as well, if you could hear me?
If I could just make a comment on that, Lubna. I'm a Deakin alum, and my first degree was in international relations and defence and strategic studies. And so I would say a couple of things. One is the importance of lifelong learning and broad education. So, critical thinking underpins all of this, and continuing to refine skills around critical thinking means that you deliver or develop different types of perspectives. So that's what I would say. Lifelong learning, continue to do these courses. The fact that I did military and defence studies, and here I am many decades later working in AI. That's not something, that's not a quirk, and you'll find that people with very broad experiences, that's what happens. So that would be my advice to students, to lifelong learning is the way to go, and critical thinking is the basis of that.
Thank you. Sankalp?
Sure. So I think the need for improved digital literacy is not a new shock finding, right? But in the post-COVID world, we'll see a big focus on digital literacy becoming a core skill, no matter whatever you're studying. Again, I'll sort of bounce back to the AI, and I'll talk about the critical aspects of AI. I think it's very important. You see a lot of these short-term data analytics courses and things. I think doing a good foundational course in your undergrad, your postgrad, or doing a formal course at uni is probably a really good idea. If you try and work in the kind of space we are working in, you can't just spin up an algorithm. There's now the Therapeutic Goods Administration is rolling out regulation for software as a medical device. If an algorithm, and we've developed algorithms to identify patients for a certain type of treatment in the hospital, they need similar certification to what's needed for a medical device. At some point, you need to certify your algorithm, and you can be held liable for if the algorithm doesn't provide the kind of, let's say, output that would be required. So I think there's the really interesting thing about AI is you actually having a background going across various fields really helps, because it's a very multidisciplinary field. Half my team is statisticians, and the other half is people like me who, in my case, I'm an electronics engineer converted to AI research with a strong background in databases and big data before I went on to optimization. So it's, and I do machine learning for most of my day job now. So you can see where I'm coming from. So another example of sort of a little bit too much study there. So I can't stress enough the importance of doing a really good course at a uni if you're looking at getting into this field, and doing things that is actually going to inform critical decision making.
Thank you so
Steve?
much. And I think I can come back to Lubna now because we can seem to hear her clearly. One thing I did just want to mention is that we note that there's a business analytics specialization. Something that's brand new into the department is also an artificial intelligence for business specialization. So I'll go to Steve now to get his views, and then I'll take it back to Lubna because you are coming through nice and clearly now.
Yeah, just to be additive, I think all the points raised were fantastic. I think critical thinking, as well as some sort of formal understanding of data. I think what we're starting to see in the type of people that we see being effective and more in demand are people who have a certain empathy for the problems that are being solved. A connection with human beings, being able to understand problems and being able to articulate what the impact of potentially that solution could be having to that customer's customers and that customer's businesses, being able to elevate the conversation beyond being just the technical aspect is becoming more and more of a differentiator. So I would encourage people to constantly look for problems to solve. Even using some of the tools I've referred to earlier becomes more available. The tech and access to the tech is not the differentiator. What's the differentiator is what Marie was talking about, you know, the critical thinking, the ability to be ethical about what you do, the ability to communicate clearly and bring people along with you are the type of areas of focus that we'll look at, certainly with graduates and people coming into our organization. Yeah.
Thank you. I think I'm looking at the time, and I think we are reaching the end of this session. So I would take this opportunity to thank the panel for their time. So Dr. Khanna, Steve, and Marie Johnson, thank you for your time and for your availability. I'm sure we have learned a lot from you today, and I'm sure people will be knocking on your doors, you know, with requests to connect and with future connections. Also, I want to highlight a little bit that if you have any research ideas, last moment, you know, so maybe we have 1 minute left. If you want to say anything about your research, anything that we haven't covered from the panel, any last words?
Look, I'll keep saying anything to de-bias data, anything, you know, AI or data to de-bias the data is an area I think we should continue to do that. Picking up fake news, you know, being able to just have closer and closer to the truth and what's actually happening. It's a great area of research.
Yeah. And I would add in there, you know, emphasis on ethics, and we're seeing, you know, IBM, Microsoft today, I think, you know, Amazon earlier, you know, stopping facial recognition type of software and services to law enforcement, and the impact on democracy. So, so ethics is not a nice to have anymore. It's absolutely critical.
And look, I'll focus my answer on the health system here. I think one of the things COVID has proven is that the system needs, for a purpose of being sustainable, we need to change from an illness treatment to a health and well-being management system. And technology has to be used to decrease cost, increase access of care, and support clinical decision making. So I think there's an overhaul. I think COVID's proven that the system needs a strong overhaul, and it needs to change from rewarding volume to rewarding value of care.
Excellent. Thank you. Thank you to the panel again. I would also take this opportunity to thank our audience. Many of you have joined us live today, and I know that there were a lot more registrants who couldn't join live. You will be able to now receive a video, audio of this presentation. Feel free to ask using the same link. Feel free to ask questions about our course offerings. Deakin University is at the forefront of, you know, analytics and AI. And I think from this panel session, we also know that the future, the next decade, will be more about, you know, analytics, AI, and data. So thank you again. And I think with that, I would draw a close on this session. Thank you, Bree, for saving me from these, you know, network issues, and thank you to the team of marketing, business analytics team, my own team, my colleagues who has inspired to, you know, run these webinar sessions. From now on, DISPA will be hosting these sessions every month, once a month, and I look forward to inviting you all back to those sessions, and keep an eye on our website for the next webinar. Thank you, panel. Thank you very much.
Thank you. Bye.
Thanks for the invitation. Bye.
Yes. Bree, I think we can